SOAP study published some results which kind of indicated that people with blood cancer might not have a particularly strong antibody response. And the study looked at cancer patients in general as well, so those with solid tumours, and sort of said, you know, it does look like the sooner you can give the second dose of vaccine, the better immune response you get. Now, we didn't have results that made it particularly statistically significant in people with blood cancer, but there are questions about whether it's better for people to have it at 3 weeks rather than 2 weeks, 12 weeks. So just before I open up to everyone to answer this, I just want to let you know that Blood Cancer UK have written to the JCVI, which is the Joint Commission for Vaccination and Immunisation, and they are the individuals who are a panel of experts who make decisions on the dosing schedule and the prioritisation of the vaccine in the UK. And we have asked them to allow clinicians and haematologists to exercise their clinical judgment. So if the clinician feels that a vaccine should be brought forward to 3 weeks, then we've asked that that should be the case. Now, we haven't had an answer yet, and we don't know what their response will be, but that is something we're asking for.
The first thing to say is that obviously when those results came out, they were on, I think, the BBC website and the BBC News. They were quite widely reported in the press and in the media. I imagine that it was pretty gutting for everybody who was sitting at home with a blood disease or a blood cancer to see how poor the number or how low the percentage of people who with blood cancer who got antibody responses after the first dose of the vaccine compared to, for example, people with solid cancers, and even more so compared to healthy people without any significant other illnesses. So I think we please understand how much we appreciate how concerning and worrying that is for you and how disappointing that must have been. I would, however, say that the study was very small. There were very small numbers of patients with a real mixed bag of different diseases and different ages. But it is likely that patients, for all the reasons we've already discussed with blood cancers, will not produce as good an antibody response as other patients with different types of cancer, just because the treatments, as we've said before, that we use are very powerful, and they're often very, very specifically designed to actually damage the immune system, because many of the cells that are the cancerous cells in patients with blood cells are actually immune cells. So, you know, we're trying to damage those cells so that we can kill the cancer cells or stop them coming back. And that a side effect of our treatment is obviously an impact on the immune system, which isn't the same for people with lung cancer or for people with bowel cancer, because those cancers don't involve their immune system. So I think what the data showed was that the antibody responses in patients who did make them with blood cancer were lower than in the other cancers. So the actual concentration of antibodies circulating in the blood was lower when it was detected, and that when they looked again at 5 weeks after the first dose of vaccine, it was lower again. So in fact, that probably they'd had a bit of a rise in antibody and then it had petered out quite quickly, which has made us keen to try and petition for patients to get their second dose of vaccine in sooner to help boost that antibody response, so that it keeps going up rather than sort of goes up and then peters out again. And I think there are other patients receiving treatments that impact on their immune system. There's lots of patients with joint disease and rheumatological things who have very powerful immune suppressing drugs. So you're not alone. And there are many doctors and organizations like Blood Cancer really petitioning on your behalf that we can be allowed to give the second dose of vaccine sooner. But I still want to reassure you or remind you that, again, this is just looking at the antibody responses, and this was in a small group of patients, and we haven't yet got detailed information about the T-cell responses that may well be protective. And actually, we don't know whether any of those patients who didn't make a good antibody response actually went on to get COVID and were infected. So there are lots of unknowns in the situation. I think we would all like to be in a position, the caveat here, this is my personal view, we would like to be in the position to offer our patients a second dose sooner. And I think we would all like to be in the position to be able to offer people who live in their households vaccination sooner than maybe otherwise indicated on the basis of your partner's or your family's medical condition. And we are campaigning for that. But as you know, there is there are 60 million people in this country, and basically we will all be the more people get vaccinated, gradually the safer we will all become. And that's true for all of you who may not make very good vaccine responses. The more actually Joe Bloggs in the street gets vaccinated, the more of them that are vaccinated, the safer you'll be.
The findings were not unsurprising because of what we said before. There was some data on T cells, and the T cell responses in that paper were great, where a higher proportion of people responded than the antibody responses. So that's slightly more encouraging, I guess. It was only with the Pfizer vaccine, so we don't have data on others. Although I'm sure it's a question that people are asking, and I get asked a lot: which vaccine should I have? Well, we have no evidence that I'm aware of that compares the vaccines and tells us which one, even in a normal immune system, is better. And I don't think we have any evidence in our patients either. But we do need more data on the AstraZeneca vaccine, which most of our patients have actually had when we surveyed our patients. And then the data on the second vaccine, there's only 5 patients, I think, in that study that had with blood cancer that had a second vaccine. 3 of them did respond, and that was often later. So I agree with Emma. We feel that it would be optimal to have an earlier second vaccine if possible, according to the whichever vaccine you have, the schedule that you should have it on. And we have been writing to our patients' GPs to ask them to do that, and some have been able to access it. But I think that's why lobbying the JCVI and the government to allow us to do that more systematically is important. And finally, and I would agree entirely with Emma, the vaccination of people living in your household and people you come into contact with regularly is obviously a sensible thing to do to protect yourself from infection. I think there was a study which showed that there's a 30% reduction in infection if your partner's been vaccinated or your people you live with. So that's a sensible thing to encourage your friends and certainly household contacts to do. We know from other vaccines that it may be that our patients need more than 2 doses even, or we have to try a different type of vaccine going forward. And it may be that the first 2 vaccines give you the base, get you to the base camp to get a better immune response later on. They're the sort of studies we're going to have to do when we have the information, and that you having had the vaccine will I'm sure help when we move forward to try and improve the response you may need to have.
It's kind of probably of no surprise to anyone that I would definitely support an earlier vaccination schedule for blood cancer patients. But although I do think the JCVI have done an incredible job, and certainly should be applauded, and the vaccine rollout has been stupendous. I think it's just been incredible. But it is fine. I think they've took a gamble to increase the dose to 12 weeks for the Pfizer vaccine, and for the general population, I think that was a very good choice. But potentially for blood cancer patients, it's not the best decision, and certainly vaccinating our household members would be appreciated as soon as possible.